and my regards to the stalwarts of the dais. So my topic is very simple. It's something that I don't need to debate on. It's very obvious, and I don't think I need to discuss because I can discuss for 3 days also. Now the point is AI in diabetes care. It's truly India's healthcare revolution. I don't have any financial inputs over here. This tool has also been, this presentation is also through AI, and you can see the amount of AI I've used to prepare this whole presentation. Just one little aspect of history, I would just like to tell you in brief that incretins were discovered 20 years back. Incretins told us what they were, and today we are using incretins in a very positive manner. With that historical background, please understand that India has 100 million adults with diabetes, projected to reach 150 by 2020. You think with the amount of cases and workload we have, you think we can manage without AI? You think rural management, geographical barriers, and the scale of the problem is possible by an individual doctor or by an institution running with hands and legs? Do you think we are going to give a good coverage without 24/7 availability, without consistent quality, and without really bridging the gap that we keep talking about through our Honorable Prime Minister about bridging the rural gap, bridging the rural gap? Am I talking through my hat? We talk evidence-based medicine. I'll barge you with a series of literature papers over here which will tell you what I'm talking. And this is not telemedicine without AI. This is telemedicine with AI, right from the stables of our own stalwarts from India. Just go through the papers and you can see that there's a huge amount of success story doing rounds with telemedicine, with AI, with different aspects of AI delivering quality healthcare. You're aware of BETO, you're aware of wealthy therapeutics, you're aware of pattern recognition, you're aware of risk stratification, you're aware of early intervention, which makes what diabetes management is all about without cardiovascular, renal axis cohesiveness in management of diabetes. You are aware of a risk prediction model and implementation concerns, which is absolutely impossible with traditional method. We are talking of some stalwarts like Dr. Jyotidev, Gopika madam, and Vishwanath madam, Vishwanath sir, and these people have been talking for ages about diabetes and digital health. How can we say that there is no AI? We are talking of a ton of literature here and abroad about development and validation of deep learning algorithms for development of diabetic retinopathy, and this is an area which has gone by a storm. Studies and meta-analysis are there which have shown consistently that pickup of diabetic retinopathy through AI is much faster, quicker, at a much broader scale than doing by an individual ophthalmologist. And if I were to show you a couple of literature, and this is from PubMed, a very venerable site, through AI PubMed, and you can see the amount of literature which is there, huge chunk of literature is there, and they all are talking about huge amount of retinal databases, retinal pickup, diagnosis and therapies, and intervention of diabetic retinopathy, all through AI, not through traditional methods. Let me walk you through some Indian startups, some Indian back home. You're aware of Arvinda Eye Care? See the amount of benefit it has done in our own country because of AI intervention and pickup of eye diseases, not just retinopathy, even cataract. Let's come to CGM. We have been talking about CGM. Banshi sir said that this is a CGM conference today. Let me show you his own article. He himself has said that, and you also know that because of cost reasons, patients are not able to do CGM as frequently as they should be doing. Can you see the live figure from Ahmedabad, the live figure from Chennai, and one of the person who has done the investigation is Dr. Hirsch. He's sitting here. Hardly 0.3 to 1.2% people are actually doing CGM as frequently as they should be doing. What do you do then? Use January. January does not need CGM physical intervention. Just do 115-day CGM and you've got the entire prediction model for the entire year. Don't you think that is real development? Let's talk about insulin pumps. We have been talking about insulin pumps in and out. And we know about the hypoglycemic attacks. We know about the poor management of diabetes. We know about the cost that they're spending on managing type 1 diabetes with insulin pump. Look at the problems: constant attachment, frequent technical issues, infusion site problems, sensor reliability, alarm fatigue, and sabse badi baat, lots and lots of hypoglycemia. The whole thing has changed when you put Medtronic 780G. Proactive corrections, reduction of mental load, enhanced lifestyle, better quality of sleep, fewer insertions, a connectivity which stays on the loop in the entire planet, wherever the patient and the healthcare provider might be, and very important, actual achievement of time in range with reduction of cardiovascular and renal morbidity and mortality. All that has been shown. Am I talking through my hat? Just look at the data here. I'll show you tons of data here. Enough data and work is there. Again, this is from PubMed, and as you can see, the effectiveness of automated insulin delivery systems through AI, there is lots and lots, and unfortunately I've got only 10 minutes. I can show you at least 50,000 articles supporting the role of AI in various facets of management. I have another 20 articles which I can't show you about muscle building patterns, resistance exercise training done in a cohesive manner, in a structured manner because of AI, which is not possible if you do not use AI. So are we treating sugar, are we treating weight, or are we treating the heart and the kidney and the eyes? Don't you think that is more important, preventing organ damage, preventing cardiac risk, preventing renal protection and foot care, something which I'm not talking about. Talking about data collection, which is very poor in our country. Talking of analysis through AI, which is 500 times faster than our brain. Talking about personalized medicine or precision medicine. All this is possible through AI, and we have the author sitting right here, Dr. Bharat Sabu, who just won an award in ADA 2025 with Mitra, which is a conversational chatbot, and ask him, he will tell you how his patient care has improved dramatically because of an API interface in your WhatsApp on Mitra. Freestyle Libre and rural expansion of CGM application being reported by a doctor sitting in Hyderabad, Dr. Harsh Hirani, who himself has developed CGM Maestro. So you do CGM somewhere and the reporting is done somewhere else, who's training it through an AI app, and the delivery is done in some other remote village in a fantastic manner. All this is happening 24/7 without your intervention. You're enjoying a movie, but your patient is getting quality care by your clone, by a virtual. There are so many leading healthcare platforms. Fantastic reduction of costly complication, fantastic improvement. The whole thing has been implemented in the IIT Madras Innovation, was incorporated a lot of these facets. What are you looking at? You're looking at reduction in billions of spending. You're looking at a reduction of 50% expenses at a national level. You're looking at millions of families being helped without having access to healthcare and doctors. Don't you think that is possible? You are trained in English, but you're treating a patient who's trained in Telugu, who cannot speak Hindi or English, and he's getting quality care by a doctor sitting in Mumbai or from wherever he wants. Towards this end, are we talking through the hat? We ourselves have founded this foundation called Shift, and we have developed certain solutions which are award-winning solutions. Look at this paper that was published, which is a comprehensive tool for risk care assessment in diabetes-related complication through AI on Asian Indian phenotype, and the results have been fantastic. Look at the CGM Maestro results. Phenomenal results we have got because of this AI intervention on CGM reports. Look at the hypo-pair GPT. You know that hypoglycemia is worse than hyperglycemia. Can you pick it up through AI? Can a patient save his life at 4 a.m. in the morning because of this app? It is possible, and who has created it? Dr. Harsh. Look at this tool which I have created, which is a drug interaction checker. We know there are drug interactions, but do we bother to check them? Don't you realize that we have a lot of problem opening up Washington Manual and Harrison and journals? So what you do is, I'll show you over here, just put up any prescription on the planet, in any language with any handwriting, as you can see, ask for a drug interaction, just load the prescription. These are some live prescriptions that I'm showing you. And as you can see over here, instantly it can read the prescription, it can tell you the interactions, it can tell you what all can go wrong. Just look at this prescription, absolutely unreadable. And I can challenge you can put it under any language in the planet, and you get such wonderful prescription interpretations. This is my own prescription, which is in the EHS system. And you can see that the medicines are read very nicely, and it is telling me straight away what are problems you can encounter, your patients can encounter before you dish it to your patient. And all this is happening at your desktop in less than 15 seconds. Don't think this is a way to go forward in life? So I'm not here to say that AI is here to replace you. I'm saying AI is artificial intelligence, which is here to augment you, address you, help you in a much superior manner, make a real impact. And trust me, the future is here. It is now. Accept it. And we believe in authorities. We don't talk of non-evidence-based medicine. Let me show you the authorities here. Dr. Rakesh Parikh said, let us listen to his opinion. Can I have the audio, please?
It's made up. For sure, AI in diabetes is the way forwards, and I fully support his stance in this debate.
1 second, please. 1 second, 1 second.
Hi friends, as you all know, I am Dr. Banshi Sabu, and I am telling you from experience that what Dr. Alok Modi is saying is the absolute truth. I have used AI myself, and let me tell you it is going to revolutionize the ecosystem of diabetes right from diagnosis, therapeutics, and prognosis and outcome. I would encourage all of you to go ahead and embrace AI in your practice.
If I can get Dr. Banshi Sabu to support me, you think I need any more proof to support my stand on this? And if I can get the judge himself agreeing to what I'm saying, do you need a more stand? And who has done this? This is AI. So why can't you become AIist? And I'll stop over here. Thank you very much. I'm the real one.
Hello. Hello. Yeah, Arun, Alok has already put his argument very strongly. Let us see what you want to say.
Is this mic on? Is this mic on? Hello?
Mic, please.
Hello? That's working now. Is there a changer? Slide changer. I think you'll have to switch off this mic. All right, thank you, chairpersons, for the introduction at the outset. Okay, is it clear? Hello? Okay, at the outset, I'd like to thank Bansi sir for the opportunity. Slide changer. This is slide changer. Tech is not working. This one? I'll move here. No, wait. Okay, I'm going to start off to commemorate the 75th year. I'm going to start off with the history of diabetes. I don't know how many of you are aware of florizin. In fact, this molecule was isolated from apple tree bark in 1835. When scientists used this molecule, they thought it induced diabetes, right? It took about 100 years later for us to understand that SGLT2 receptors existed, and these molecules in fact inhibited the receptors. That is how the glyphosins were born. With that, I'm going to now take on my good friend, Dr. Alok. I think he had an excellent presentation. Only towards the end, I felt that he made my case a little lot easier. He in fact had fabricated video of two of experts here, which indeed is the exact problem that we are currently facing with artificial intelligence. Now, where do we stand with regards to AI? In the current scheme of things, we have structured data, we have unstructured data. Structured data could be HbA1c, glucose numbers, lipid profile, all those are structured. Unstructured is clinical notes, images, it could be retinal ultrasound, all kinds of images. All those are unstructured. Now, structured data goes through supervised learning. Obedient child, right? That goes through supervised learning. Unstructured data goes through unsupervised learning, and then you're clustering it, dividing it. You're also identifying certain anomalies over there, right? So that's how the current scheme of things is. Finally, they go through algorithms for real-world applications. Now, as clinicians, where do we use AI? For diagnosis of diseases, like Alok sir said, retinopathy diagnosis, to predict complications, right? You do risk stratification and understand which complications are going to occur when. Patient selection, which means precision medicine, and then in monitoring, which gives you alerts. I think these are the places where we would perhaps be excited about AI. Of course, indeed, the future looks very exciting, extremely promising with AI. However, We are still in infancy stages, isn't it? AI is exploding, right, as we speak. But you should remember, we don't even know what is in store for us. What the future holds, we are only going to see it, witness it with time. The current challenges that we face in AI is the regulatory compliances, the ethical issues, and of course the data itself. Now, why is data so important? Now, data can be scattered, data can be incomplete, data can be only from certain pockets of the society. Now, AI is as smart, the output depends or hinges on the data that they feed into it, right? The WHO recently said, if the AI does not get a perfect representation of data across the board, AI itself could be biased. Like how as clinicians we could be biased with like certain drugs, certain trajectories of thought process, right? Or we follow ADA society and apply in India. That kind of biases can happen with AI if we do not have the actual data. And even though algorithms can be different, with poor data, the outcomes can actually vary. Now, the data can be of two types. One is the unimodal data type. Let me explain what that is. Retinopathy, right? Images, you look at only data from one source. That is unimodal. What is multimodal? That's the real challenge. Now, data that comes from patients' genetic, environmental factors, as well as patients' current health status, diseases, comorbidities, and to make things worse, you have Fitbit, you have whatnot, sleep, exercise, all these data are processed, crunched, and gives you an output. Now the problem here is there is something called a black box. Black box is with so much of neural network. Black box is something we cannot even decrypt. It is humanly impossible. We don't even know how AI came up with this particular output. Let me give you a hypothetical example. Suppose we have a patient with a GI bleed about 1 week, 10 days back, right? A patient has an indication necessary for patient to be on anticoagulants. We feed in a lot of data. We say, okay, this is the reason patient needs to take anticoagulants, coagulation profile, so on and so forth. And the AI gives you an output. How can we trust that? How can we trust that rationale without actually knowing the thought process, right? That's exactly where we have challenges with the AI. And of course, there are ethical issues. Who's in charge of the data? Now, data, are clinicians, are we responsible? Or the healthcare infrastructure? Or the tech which developed the AI, or the local government? Who's in charge? These are, time with time we'll understand what more, who is responsible. Added to that comes the security, right? Today, we are very much concerned about who to become our friend in social media, and we are concerned about what we don't want our data to go public, right? We are very secretive about our life, and probably privacy is the new privilege. Now think about healthcare data. Actually somebody can tap into it, hack into it, understand. Now how dangerous can that be, right? And that's why it could be hacked, there could be cybercrime. For instance, think about the sensor augmented pump. Somebody can control and release all the insulin within 30 seconds. That can happen, right? So those are the challenges that we are likely to encounter. So we must ask ourselves, what are the challenges? I'm going to show you some case reports in my subsequent slides. Now, the Google Gemini came up with a new nomenclature, which is what? Basilar ganglia. It doesn't even exist. These things actually kind of pose a conundrum, right? It confuses the entire table, entire thought process. So these are clear challenges. And look at this. This was approved by, sir also shown this, US FDA approved diagnosis by AI in 2018. This study demonstrated in about 250 patients, only 60 patients had mild retinopathy as proven by AI. 3/4 of them did not. Right? What's the point? You have very fast screening. It has to be accurate, right? Right? So those are the challenges. And here we have again the insulin pump. What had happened was this patient was also on a GLP-1 receptor agonist. Patient had few episodes of vomiting, dehydration. And in dehydration, we know how accurate the CGMs are. CGMs showed a blood sugar value of lower than 60, 70. So by feedback, the pump did not produce any insulin and patient status worsened, landed up in DKA. So that is why a human layer always is extremely important. Another study which shows that clinicians who depend on AI can sometimes prove fatal, right? So it's always a human layer which is extremely important. We cannot completely blindly depend on AI and let it answer for us. We've heard of this accident with Tesla. Maybe 99 cars go well, run well, but that one car which falls off the cliff, what happens to that? Right? So we cannot blindly always depend on AI. And then the dehumanizing effect. Finally, what do patients want? I have patients even now who come in and tell me about 40 to 50% of their disease is taken care of by the way we talk, by the presence of the doctor itself. That's the kind of profound impact as humans that we have, which can never be done by an artificial intelligence. The very tools designed to help disrupt the therapeutic elements, it cannot, with the cold, a human automated response, we cannot overcome empathic human touch. Finally, the last two slides to conclude. AI is indeed a powerful tool, absolutely no doubt about it, but it is not something that we can blindly trust. Even the developers have advocated for a human in loop. The future of diabetes care is not artificial intelligence, it is human intelligence, but augmented wisely by tools that we understand. And finally, I think the buck stops with the doctor. With that, I'd like to conclude. Thank you.
Hello. Yeah. Thank you, Arun, for your absolutely perfect arguments regarding the artificial intelligence. I think this is a reality sort of thing. We, during our residency, we did not have computers, we did not have a mobile, nothing else. We used to elicit all inspection, palpation, and percussion, and we elicit sign and symptoms from the patient, and we elicit the signs, and then we used to diagnose even a mitral regurgitation, mitral stenosis, whatever the minor murmurs, early systolic murmur, early diastolic murmur, mid diastolic murmur, we used to hear from our ears, and that was the era we have come from, and now it is artificial intelligence, just put some biochemical parameters, everything, and now the diagnosis is there. I don't know, we are in an evolution phase, so can we give Alok 2 minutes?
Dr. Alok has promised to go easy on me today.
So let us see how the Alok responds.
Thank you, sir. That was very nice. And actually, Dr. Arun, my dear friend, he made my job very clear and very nice. He himself concluded that it is a human in the loop which is important, which is what I said. AI is not replacing intelligence. It is augmented intelligence. Nowhere have I said or anybody says that AI is here to replace you. That's never been the intention. And sir, like you said, the stethoscope works today, the murmurs work today, the echo is working today. But then why are we using it? Because our sensitivity and specificity has gone up. Please understand the differentiation. We keep guns in our pocket to protect ourselves, not to shoot people unnecessarily. That is terrorism. Let's not make AI a terrorist because we are making it. AI is not a terrorist. Now, Dr. Arun very rightly said that 2018 paper showed deficiency. We are in 2025. Now, when I joined medical college, when you joined medical college in residency, your diagnosis was not perfect. It took time for you to become perfect. AI is also taking time to become perfect. So, if you committed a crime in first year of MD medicine, does that mean you are doomed for life? You cannot do MD medicine? So, if AI made a mistake in 2018, does that mean in 2030 you say bye-bye to AI? No, it is an evolving thing. Remember, at the end of it, AI is here to augment, help, improve, do things which have not been done in the past. Can you give quality health care by listening to a murmur of a person sitting in a village in Tricura or you are sitting in Mumbai? AI can do that. Can you do that? No. If there is no doctor, what can you do? Does that mean that patient does not get services? So, talking about security, what he rightly said, there was no security 50 years back when there were no computers. Looters were looting the village that time also. Today you have security in your house and you cannot get a person entering your society with our digital thing. So does that mean that today we are less secure and we were more secure yesterday? No. There is no data privacy loss because there is something called as blockchain technology, there is something called as data privacy issues. All those things are there, and there's something which people don't know. When you're working on ChatGPT or Grok or Perplexity, these are generic LLMs. They are not designed to do medical work. But when you have a specific LLM which is designed for doing medical work, which is a different kind of a training bot that you do, the accuracy goes up to 98 and 99. So that is like somebody coming as a Google patient and telling you, oh, I've got brain cancer because I've got headache. He is a generic LLM. Whereas you have an MD medicine who says you don't have a brain cancer, that is a qualified trained doctor. So don't compute AI with a Google patient. That's what you're doing. So let's not blame AI by having wrong notions about AI. Train the AI properly. Put it on an LLM, which is an Indian server, which is as per the DPTT Act, and that is what we have done in our own Shift Foundation. We're not using generic LLM. Let's not just go for ChatGPT and start treating patients in our hospital. Who told you to do that? That's a wrong way. That's using AK-47 to kill a mosquito. Why blame AK-47 for that? So let's have our vision and our thoughts very clear. AI is fantastic. You are the helm of it. You are sitting in the driver's seat. Learn to drive it properly. I always say that. You are make money, you have got a Audi, you have got a Mercedes. You are sitting behind, not in the driver's seat. Why do you blame Mercedes for that? So AI is here, use it, but use it appropriately and ethically. That's what my dear friend said, and that is what even I am saying. So where is the debate? The debate was whether we should use AI or not to use AI. He himself says use AI, but ethically, but that is even what I am saying. I never said use it.
Saying with the human layer, of course.
Okay.
So there is an overlapping place where both of us
Dr.
agree.
A.K. Singh is here, and I am actually in CME just Resmetron, and he was so against AI since morning. I am just reading that CME, absolutely. So I think we are still in a phase. We want to hear from our expert. He's a young diabetologist from Jaipur, Dr. Rakesh Parekh.
I think there is an overlapping area where my good friend both of us.
But okay, you can
Go for it, sir.
have. You
Well, I
can
think there's an
have.
overlapping area where both of us agree, but as you brought in the fintech blockchain technology, we know that manually you cannot go steal $100 million, but that's happening today with cybercrime. That's exactly the issue, because we don't know what future is in store. We could perhaps control so many thousands and lakhs of patients' data with a touch of a button. We don't know what is in store. So that's the issue, Chandra.
Rakesh.
So I think both these speakers cover the topic very well, and they both seem to agree that AI is the future, but we need to be careful. And I think the debate was rather showing us both the sides of the coin. So there is no doubt that AI is going to have a role to play in the diagnosis, prognosis, classification of diabetes by clustering, even the treatment, and so on, so all those things are there for the future. And the challenges that Arun pointed out are also very valid. The challenge of data security, the bigger challenge of black box, like even we don't know how the AI works, so we don't know what could be the problems. Another challenge that was raised by Arun, what I feel is important is that, just like Arun sir said, in these days, they used to diagnose patient clinically. The clinical skills were very high. But my generation, our skills got deteriorated because we had the tools. Now AI is another tool. If we overuse it and over-rely on it, probably we'll lose our clinical acumen also. So let's use it as an assistant, as both of them said, to augment our knowledge, but let's not rely on AI completely. Thank you.
Absolutely well argued by both Alok and Arun Raghavan, and let us have the audience reactions. So who is in the favor of Alok? So it means, and I think rest of the things, okay. Who is in the favor of Arun? Oh, so it is absolutely. So this clearly says that we are in an evolution phase and we have to use AI, but judiciously. And still, I think we are way ahead to go for the AI to use in a medical science.
So it clearly says that we need another conference next year where we repeat this thing and then we take a count of hands. Okay. And in the meantime, we train the audience about AI.
Okay. Thank you very much. Thank you, Arun, and thank you, Alok, for